The Eastern Cape Health MEC Sindiswa Gomba has warned that the province could see a surge in COVID-19 cases. Around 20 people a day are testing positive for the virus in the Nelson Mandela Bay metro. The Herald newspaper reporting today that Dr. Siva Pillay, an advisor at the Nelson Mandela Bay COVID-19 Joint Operations Centre, says that now more than ever people need to be vigilant as a surge in cases has been seen. So what is the strategy amid fears of a second wave in that province? Joining us now is Dr. Luvuyo Bayeni, who is a technical advisor to the MEC. Doctor, good afternoon to you and welcome. New warnings being sounded today by the Eastern Cape government. Do you believe that the province is heading for a second wave?
Good afternoon, and good afternoon to the viewers of eNCA, and thank you for the opportunity for us to be sharing how the province is going to address the issues of the scourge. Indeed, we are confirming that we are worried and skeptical about the scourge of the second wave. And not only is it because it's theoretical, but however, we are experiencing the growth in the numbers that are even, to a certain extent in other areas, even worse than what we were getting previously. As you might have alluded in your background, that we have even seen a minimum of 20 for Nelson Mandela over some time. And that has even worsened, if I may even share with you, in terms of our accumulative reporting, that in Nelson Mandela alone, this morning's report had even accounted for 298 new cases. On the 27th, it was about 218 new cases. So that on its own, looking at the numbers, is confirming that we are no longer talking theory, but it's a reality that we are facing on the ground as we continue to test people.
Right. So, Doctor, is the problem with your strategy then? Do you need to change it?
Well, not on our own. I think what we have acknowledged and appreciated is that all the avenues and strategies we were using in the previous levels, including level 2 upward, what had made them more effective was also the joint cooperation between the government strategies, the corporate business, and as well as the citizens as well of the Eastern Cape, especially in the metro areas. But we must say that what we are seeing, and very disappointing, is to see that even behavior-wise in the society and in the areas that we are covering, you seem to see that people are outrightly neglecting what we had outlined as part of the preventative measures. A typical example being that of the masks. Previously, in the other levels, between from 5 to 2, people were compliant in terms of the mask, people were compliant in terms of the distancing and even your sanitizing. But what is real now, which is still disappointing for us, is what we see that people are doing the opposite. Worse of that, we always remind them that the president has been consistent in his message that it's all in our hands, which means we would even achieve more where we would get cooperation from people as well as strengthening our strategies as a department.
Right. Dr. Bayeni, one issue that you have raised is concern in taverns in the metro. You're worried about it, yet a spokesperson for the Eastern Cape Liquor Board says he's not aware of taverns being a source of infection. There's a complete disconnect there between what you're saying and what people believe.
Well, what has been consistent, with us in terms of messaging is relating the message as we see it on the ground, over and above everything else. Hence, even when I started, I said the unfortunate reality now is what we are seeing, and we quoted numbers. And the second thing is that as much as we might not be the gurus of social media, but we are not oblivious of what we see happening. And those sins that me and you might have been seeing are live sins, and most of them are happening in the areas of social entertainment, and which in the main would have been regulated by the Liquor Board license regulations. So we are relating on what we have seen and what we know is happening. And the reality of the matter is, on the scenes alone, whether you were there or not, you would obviously see that there is no social distancing, there is definitely no masking. And the worst part of it is that even the tenants of those places of entertainment they know the regulations have even prescribed that they must take half the number of what their capacity is. But what we can see definitely on what is being shown and being flighted is that even some of these areas are not even doing 50% of their capacity. And when you look at the scene, sometimes you even suspect that they might even going even aboard in terms of what was allocated when they were issued licenses. But we might not as health always be there in terms of the safety and security measures. But what I know is that especially in the metro area, the municipality together with the joint security cluster have entrusted and ensured the people of the metro that they would be doing those physical visits and monitoring, especially in the areas of entertainment, and they would not be issuing the schedule because they want to be able to do their job without being interfered or being manipulated by people trying to work around the schedule.
Doctor, thank you very much indeed. A thorough examination and analysis of the situation in the Eastern Cape. Disturbing that people are flouting the regulations. Dr. Luvuyo Bayeni from the Eastern Cape Health Department.